You know, certain shoes can be hazardous to your foot health.
And if you're wearing high heels or flip-flops, you may not realize just how severe the damage can be. Heel pain is an increasing chronic problem, and joining us this morning, podiatric surgeon Dr.Weil with what you can do. Thanks for joining us.
Thanks for having me.
Okay, so tell us, what are the problems these flip-flops and heels cause?
Well, I've brought some different things. For instance, I've brought this very stylish high-heeled shoe, and it's very cute.
Very cute.
But it's extremely high. Now, some women can get away with wearing a shoe like this, but many cannot. And the pressure of being in too high of a heel position can put too much pressure into the ball of your foot. But more importantly, when we talk about heel pain, is if you wear a high heel for a long period of time and then you go to a flatter shoe like a flip-flop, that change in position is what tends to cause a lot of problems.
Ah, gotcha.
How about folks with low arches wearing that kind of shoe?
Well, with people with low arches, and most people do have a propensity for lower arches, they can be more susceptible for problems when they wear something like a flip-flop. But many people can get away with wearing flip-flops without any problems. Flip-flops allow the foot to spread out and be very comfortable.
You wear it for a long time, you got to be developing some problems maybe, huh?
Yes, if you walk too much with flip-flops, often you'll end up in my office with some heel pain.
What are some of the things you can do at home if you are discovering that it's not working for you?
Well, when you start to have heel pain, which is really common, 15 million Americans get heel pain, there are different things you can do. A lot of people will like to use a tennis ball, and they can roll a tennis ball into the arch in the heel, and that can massage and make it feel better. Also, you taking a bottle of water and freezing it and rolling it into your arch and heel for a few minutes a day, again, massaging and icing to reduce the swelling that is a component of the problem of heel pain or plantar fasciitis.
I always wondered about these insoles you have. Do those work?
You know, insoles work, whether they're over-the-counter or custom. I've brought some custom things called orthotics, and many people who don't get successful treatment with over-the-counter treatment, we have things called orthotics. There's different types of orthotics. There's a harder one for athletics that's a bit on the stiffer side to support, and there are softer ones. Some people need softer, more flexible ones that are more comfortable in certain situations.
I understand you're to give up running shoes after 500 miles. How do you know that?
Well, you have to well, the shoe companies have done their research on it, and different running magazines have done research, but you should log your miles, and at 500 miles or sooner, you should turn over to a new running shoe, and when you're done with it, it doesn't go to walking or just hanging around. It's done.
Okay, and now we're going to take a look at this treatment I've never heard of. It's the shock treatment. Tell us what you're doing here.
Well, with chronic heel pain, many people are unsuccessfully treated with conservative care, and something called shockwave therapy or sonic shockwave therapy has been utilized. And we take high-energy sound waves and we put it in the area of pain. And the patient is going to be feeling and telling us where their pain is while we're doing it. And we're actually blasting the pain with the shock wave that will break up scar tissue and stimulate healing. And over this summer, we're actually offering a discount, a 50% discount from Memorial Day to Labor Day for people who want to take advantage of that.
Give it a try.
Great. Thanks very much for being with us, Doc.
Thank you very much.
You can head to CBS2Chicago.com for more information on Dr. Weil and those treatments. It will be on our links and numbers page.